The normal axillary temperature of a newborn in between which of the following ranges? 42 degrees centigrade, 32 degrees centigrade, 32.5 to 34 degrees centigrade, 36.5 to 37.4 degrees centigrade. And here the right answer is 36.5 to 37.4 degrees centigrade. Antidote of magnesium sulfate is calcium gluconate, potassium chloride, sodium nitroprusside or verapamil.
And here the right answer is option A, calcium gluconate. Calcium gluconate is the antidote of magnesium sulfate. Client on magnesium sulfate therapy should be monitored for deep ganglion reflex hourly. Cardiac and renal function is monitored closely. The urine output should be maintained at 30 ml per hour because the medication is eliminated through the kidneys. Which among the following is the potentially harmful side effect of epidural anesthesia? Hypotension, headache, decreased urine output or increased respiration. And here the right answer is option A, hypotension. Hypotension is the potentially harmful side effect of epidural anesthesia as it causes placental insufficiency by decreasing perfusion to the placenta. The therapeutic uses of laparoscopy are treatment of endometriosis, tubal ligation, ectopic pregnancy or all of the above. And here the right answer is option D, all of the above. Immunoglobulin present in breast milk is IgA, IgD, IgG or IgM. And here the right answer is option A, IgA. IgA provides immunological defense to the newborn and is present in breast milk. A newborn with acquired herpes simplex type 2 infection often exhibits deficit in GI function, renal function, GU function or skeletal function. Here, GI means gastrointestinal and GU function means genitourinary function. A newborn with acquired herpes simplex type 2 infection often exhibits the deficit in renal function. So here option B is the right answer. These infants may renal dysplasia, so impaired renal function will be there. Which of the following occupation accounts for the highest percentage of workers in the National Health Services? Doctors, nurses, technical staff or ambulance staff. And the highest percentage of the workers in the National Health is nurses. Which of the following is not a step of planning? Briefing, execution, strategic healthcare planning or needs identification. And here the right answer is option B, execution. Briefing, strategic healthcare planning and needs identification are all the part of planning process. Execution refers to implementation to plan. Population doubling time in coliform bacilli is 20 seconds, 20 minutes, 20 hours or 20 days. And here the right answer is option B, 20 minutes. Methicillin resistant bacteria are Streptococci, Pseudomonas, Haemophilus or Staphylococci. And the methicillin resistant bacteria are Staphylococci. In the second stage of labor, which one of the following injections is given to improve the uterine contraction? Prostaglandin, oxytocin, Phenergan or diazepam. And here the right answer is option B, oxytocin. Oxytocin is a hormone secreted by posterior lobe of the pituitary and is necessary for uterine contraction. It also helps in milk ejection, so oxytocin reflex is also known as milk ejection reflex. Rama is pregnant for the first time and at 12 weeks POG or period of gestation. Her USG suggestive of twin pregnancy. Her graviga is graviga 0, graviga 1, graviga 2 or graviga 1 plus 1. And here the right answer is option B, graviga 1. Rama is pregnant for the first time, so graviga 1. Even if the woman is having twin pregnancy, it will be considered as graviga 1. Serious danger associated with low birth weight baby is respiratory distress, feeding problem, thermoregulation problem or hemorrhage. And here the right answer is option A, respiratory distress. As per psychoanalytic theory, the ability to tolerate frustration is seen in ego, superego, or unconscious. And here the right answer is option B, ego. Mitigating frustration within the real world is an ego function. Imposing one's own weakness to others is a defense mechanism known as projection, intellectualization, suppression, or displacement. And here the right answer is option A, projection. Projection is a defense mechanism that involves taking our own unacceptable qualities or feelings and imposing them to others. Psychosexual development stage of a toddler: phallic stage, anal stage, genital stage, or oral stage. And here the right answer is option B, anal stage. As per the psychosexual development theory proposed by Freud, and toddler belongs to anal stage of development. Babinski reflects the movement of Greg to undergoes dorsiflexion, dorsiflexion, plantar flexion, or plantar adduction. And here the right answer is option B, dorsiflexion. Immediately after the delivery, baby should be placed mother's breast, mother's abdomen, side of the mother, or radiant warmer. And here the right answer is option A, mother's breast. ACTH or adrenocorticotropic hormone secretion is highest during noon, evening, morning, or night. And ACTH secretion is highest during morning time. So here option C is the right answer. Gigantism is caused by abnormality in the secretion of growth hormone, thyroxine, adrenaline, or vasopressin. And here the right answer is option A, growth hormone. Which of the following is not the element of a research statement? Research design, research instrument, population, or seeking? And here research instrument is the right answer. The principles of ethics in nursing research include beneficence, respect for human dignity, justice, or option D, all of the above. And here all of the above are the right answer. All of the following are conflict resolution strategies except collaborating, resistance, smoothing, or avoiding. And here resistance is the right answer. Resistance is the refusal to accept or comply with something. Resistance increases the conflict by increasing dissatisfaction in group. Conflict resolution strategies are avoiding, collaborating, smoothing, repression, and sharpening.
Respite care refers to palliative care, rehabilitation, part-time supervision of patients with chronic conditions, or end-of-life care. And here the right answer is option C, part-time supervision of patients with chronic conditions. Respite care is the short-term or temporary care of the sick or disabled for a few hours or weeks. Philadelphia chromosome associated with which type of cancer? Leukemia, nerve, thyroid, or breast? And here the right answer is option A, leukemia. The stem cell used in the peripheral blood stem cell transplantation or PBSCT should come from the process of dialysis, apheresis, leukapheresis, or both B and C. And here the right answer is option C, leukapheresis. The stem cells used in PBSCT come from the bloodstream. PBSC for transplantation is obtained through a process called apheresis or leukapheresis for 4 or 5 days before apheresis. The donor may be given a medication to increase the number of stem cells released into the bloodstream. Type of venom produced by snake shown in photograph is myotoxic, neurotoxic, hemolytic or proteolytic. And this snake produce neurotoxic venom. Instrument shown in photograph is used to assess environmental heat measurement, cooling power of air, mean radiant temperature of surroundings, or relative humidity of air. This instrument is used to assess for relative humidity of air. The machine shown in photograph is used in hospitals for X-ray, CT scan, MRI or PET scan. And this is the X-ray machine. Irreversible injury in myocardium occurs after 15 minutes, 30 minutes, 45 minutes or 60 minutes. Irreversible injury in myocardium occurs after 30 minutes. So here option B is the right answer. The inhalation of barium containing dust in the industrial area leads to cheilicosis, cheilosis, barytosis or barium case. And here the right answer is option C, barytosis. Raju is recently diagnosed with metastatic lung cancer. What is the expected reaction from him? Denial, anger, depression or acceptance? And here the right answer is option A, denial. According to Kabler-Ross stages of grief process, first reaction will be denial. Raju won't accept the fact that he is having metastatic lung cancer. Kabler-Ross stages of grief include the denial, anger, bargaining, depression and acceptance or GABDA. তো বন্ধুরা এই ছিল আমাদের আজকের ভিডিও কেমন লাগলো অবশ্যই জানাবে এবং এরকমই পরস্পর ভিডিও পাওয়ার জন্য চ্যানেলটি অবশ্যই সাবস্ক্রাইব করে বেল বাটন দিয়ে দিও and thank you for watching this video.